Oriented to person, place, and events, and appears stated age within recommended weight. States has access to 3 meals a day, posture erect, gait even and regular, no involuntary movement. Denies use of assistive devices, pleasant and friendly, speech clear and appropriate. English is primary language. Mood and effect correlate with topic. Clothes neat and clean. The skin was uniform and matched ethnicity. Skin was warm, dry, intact with no lesions. The hand grip strength was strong and equal. The nail beds were pink and firm with negative profile sign. The cap refill was less than 2 seconds. Peripheral pulses were strong and equal bilaterally. The head was normally cephalic, no lesions, lumps, or scaling, no tenderness. The temporal arteries were palpable and equal bilaterally. Cranial nerve 5, the trigeminal nerve was intact. The TMJ articulated smoothly. The face was symmetrical. Maxillary and frontal sinuses were non-tender. For the eyes, the cranial nerve 2, which is the optic nerve, was intact. Near vision demonstrated by reading fine print at arm's length. Cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens were intact without nystagmus. The eyebrows and eyelids were symmetrical without lesions, redness, or edema. Conjunctiva was pink, sclera was white, cornea was clear. The pupils were equal, round, reactive to light accommodation. The ears had no masses, lesions, or discharge, no tenderness to palpation. The canals are clear. The cranial nerve 8 was the acoustic nerve was intact. The patient heard whispered words equal bilaterally. The nose was symmetrical to face, nearest patent, septum midline. Cranial nerve number 1, the olfactory, was intact. The lips were intact without lesions or ulcers. Buccal mucosa was pink and moist. Gums pink, moist, and intact. The teeth was present and in good repair. The hard and soft palates were smooth with no lesions. The tongue protruded midline. The pharynx was pink with no exudate. The uvula rose on phonation. Cranial nerves 9, 10, and 12 were intact, which are the glossopharyngeal, the vagus, and the hypoglossal. The trachea was midline. The lymph nodes palpated and were palpable and denied tenderness. Were not palpable and denied tenderness. The carotid pulsations were equal bilaterally with no bruise. Cranial nerve 11, the spinal accessory, was intact with full range of motion against resistance. The thyroid was non-palpable and non-tender. The AP to T diameter was 2 to 1. It was negative for the patient was negative for CVA tenderness. Respirations were 16 breaths per minute with no use of accessory muscles to anterior or posterior chest. The anterior and posterior thorax was clear to auscultation. There were no adventitious breath sounds heard. The apical pulse was palpated at the 5th intercostal space at the left mid-clavicular line. The pulse was 72 beats per minute with regular rhythm. S1, S2 were noted. No gallops, murmurs, or rubs were. The clear heart sounds were heard throughout. The abdomen was flat, symmetrical, with soft skin that was smooth with no lesions, scars, or striae. The umbilicus was midline. Vowel sounds were heard in all 4 quadrants. During percussion, tympany was the predominant sound. The abdomen was soft, non-tender, with no organomegaly or masses upon palpation. The extremities were all had equal peripheral pulses that were present and equal. The upper and lower extremities were symmetrical, which included the hair distribution, and there was full range of motion against resistance. Neurologically, the heel to shin test was negative. The patellar reflex test was 2+ bilaterally. The scoliosis screen was negative. The spine was in alignment. Shoulder height in the scapula and the iliac crest, gluteal folds, and elbow gap were all symmetrical.